We're live?
We're live. How do I start?
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum, and this is Back at It with Dr. Decompression. Welcome. I'm Dr. Dudum. This is Back at It with Dr. Decompression. We have episode 7 today. Today's episode is sponsored by Pillowise USA. I want to thank them for their support. And if you are looking for a new pillow or curious how their pillows work, they have 6 pillows. You choose based on the way you sleep, the firmness of your mattress, and the measurements around your neck. You can find a specialist on pillowise-usa.com, or you can contact our office, message us, and we're happy to give you some more information. Thanks, Pillowise. Super excited. Today we're going to talk about, the first 6 episodes were a theme of spinal decompression or non-surgical spinal decompression. Today we're going to talk about, does this work? Like, will this work for you? And does this thing really work? We've gone over case studies. There's case studies to review for the listeners that 10, 12 years ago, there's a case study of 100 patients that use this, and it helped open the disc space. It helped reabsorb the disc back into the canal, that type of thing. It's one thing to hear research, but, does it work? Like, does this really work? So I want to talk today about a patient. This is awesome. This patient came in, young guy, 32, lower back pain, radiating to his leg, struggling, severe back pain. We saw him, we had an MRI. The results were one of the largest disc bulges I have ever seen. About a half of an inch, almost 3/4 of an inch. If you're watching it, if you can see, it's about the size of my thumbnail or your thumbnail. It's huge. And obviously a surgical candidate, and obviously in a lot of pain, down to his leg. He wanted to avoid surgery. So he's talking to me. He might think in his head, similar to the way that you might be thinking, does this thing work? Like, is this spinal decompression program going to work? Is it a bunch of hoopla? Other doctors have maybe told you that, hey, it doesn't work, or other therapists or other practitioners that it doesn't work. I am here to tell you today, it freaking works. Like, this works. How can I say that so confidently? How could you just make a claim like that? Good question. I know you're thinking that in your mind. Good question. And I only say this through passion for helping people. As you, in episode earlier, I think it was episode 3, that was my story, that I had a disc bulge. And I know it works because my 5mm disc bulge was reabsorbed, my leg pain is gone, and my back pain is gone. And I'm able to live my life with my kids, my wife, my family, do the work I love to do without back pain. So I know it works with my own body. I've also seen it work with thousands of patients that we've seen with this program, that it works. Let's go back to the patient that's 32 years old with the back pain and the 18mm disc bulge. I'm going to read, I have objective findings. That means I have proof, pre and post, proof. This patient had an MRI in July, and it showed at the L4, L5, which is almost at the bottom of the spine, and the nerves exit that area, go down into the leg. 18mm at the L4, L5. It says large paracentral disc extrusion. In the next few episodes, we'll talk about the exact anatomy of a disc. What's an extrusion? A disc 101 is a disc is a jelly-filled donut. And you've got an outer capsule called the annular fibers. It's the more fibrous part. And then you've got the inside, which is the gel or the liquid. It's about 60 to 70% fluid or water. An extrusion is one of the worst you can have. meaning that water or gel substance is actually squeezed out into the spinal cord. Meaning we squeezed a donut and the jelly of that donut went out of the donut and it's floating now. That's an extrusion. So think if you had 18 millimeters of jelly in your spinal cord. That would be painful. Patient went on we did an exam and a consultation. Through our very, very detailed process, we indicated that this patient would probably benefit from our decompression program. So we started the program. What did he get? He was on over 20 sessions of decompression. I know it sounds like a lot. You're thinking that's a lot. Wait till we get to the end. We did a few chiropractic manipulations. He had cold laser therapy every session. Cold laser helps reduce inflammation. It helps decrease pain, the pain connection to the brain, pain receptors. We did power plate rehab exercises. He stands on a power plate and he does corrective exercises on the power plate to stabilize the small, very small intrinsic muscles that stabilize the spine and they hold the spine together to prevent a further disc bulge. He also had passive modalities, muscle stim, ice, those types of things. 8 weeks he came in. 8 weeks. I know you're thinking, dang, that's a long time. 8 weeks. After 8 weeks, feels a lot better. Has a small trace of the pain, not 100%, a very small trace. Well, did it get better? How are we going to know? Does it work? Does it work? I was so confident that it worked. Hey, let's get a follow-up MRI and let's check the progress of that 18 millimeter disc bulge and let's see if hey, did we make it worse? I say that because we'll hear a lot of practitioners, people, other people outside of these four walls that we help that say, oh, don't do that. It's going to make it worse. Not only does it not help, it might make it worse. So let's take an MRI. Let's compare apples to apples, as they say. And I'm here to tell you, this is the first time we're going to share this kind of story. This is awesome. Thank you for listening, by the way. I'm super excited to talk about this. So he had an 18 millimeter paracentral left extrusion. Let's say that again. He had a large 18 millimeter paracentral disc extrusion. That's in July. October 3rd, that is August, September, it's 8 weeks later, literally 8 weeks later. Here we go. At the L4, L5, there is a 3 to 4 millimeter disc bulge. 3 to 4 millimeter slight paracentral protrusion. 18 millimeters to 3 millimeters. On the radiology report, the previously noted superiorly extruded fragment has been predominantly resorbed. If you're watching, that is a frickin' report that says it's been the previously noted superiorly extruded fragment has been predominantly reabsorbed. This patient went from an 18 millimeter disc bulge 8 weeks ago to a 3 millimeter. It reduced 15 millimeters. 15 divided by 18 is like over 80% reduced. I bring this case study up because I know that you're listening to this and you're either on our program, you're thinking about our program, you have a mother that has a disc bulge, you have a friend, a husband, a son, you know someone that has a disc bulge, and you're trying to figure out what to do. You've done a bunch of different things. You've tried maybe adjustments. You've tried maybe physical therapy. You've tried other therapies. You've tried acupuncture. You've tried healing. You've tried massage. You've tried cupping. I could list 100 things that you've probably tried. And you've gotten to one conclusion. You're either still in an amount of pain, or the pain keeps coming back and it's not solving the problem. Spinal decompression works. We have evidence in studies from 10 years ago. We also have case studies with pre and post MRIs that this technology and the way that us here, Dr. Dudum, and our Dudum team of chiropractic physicians, medical assistants, massage therapists, Pilates instructors, our team, we get results. And the program works. Worked for me, saved my back. Again, it's worked for thousands of patients. So all I can tell you is, if you're curious about this, you should reach out to someone that does spinal decompression. You're not going to get anyone unless they've experienced this program, because no one knows about it. My goal through this platform is to tell people how this works, to show them that it works subjectively, meaning that people that feel better, subjectively they feel better, but objectively, with pre and post MRIs, the disc reabsorbs. It just happened 3 days ago to a patient. So I want to thank you for listening to this. I had a little different tone on this podcast as I'm a little excited about the results we just got. And we get these results every single day. All we do is specialize in spinal decompression. So thank you for listening. If you're watching on YouTube, thank you for watching. I'm really excited. The next episode, episode 8, we are going to talk even more about some case studies. We talk a lot about lower back and lumbar, but you may be experiencing neck pain or cervical pain or an issue somewhere in your arms or your hands. So we're going to dive into spinal decompression and how does it work for neck and arm related issues. So I want to thank you for listening. If you haven't followed us or subscribed, please hit the button. Make sure you follow us on Instagram at Dudum Chiropractic and YouTube at Dr. Dudum. I also want to thank Pillowise USA for sponsoring this episode. Thank you again. I'm Dr. J. Dudum. This is Back at It with Dr. Decompression. Thanks.